All right. This is Diana. All right, is everyone ready? Are the interpreters ready? Is everyone, is the board ready? All right, getting yeses from everyone. Audience, are you ready for this? All right. Thank you for coming out today. I do realize that the weather is not excellent. And also the parking was not great. It was tough, to say the least. So some people had to walk quite a while, about miles, I would say, to make it in here. However, thank you for coming out anyways. Okay. So we're going to call the meeting to order at, what time is it? Can I get a time? 10:50. At 10:50. First of all, let me go back a little bit. So communication access. Is everyone able to see the interpreters, the captioning? Does everyone have access right now? Everyone's getting thumbs ups. Online people, is everyone okay? How do we know if everyone's okay? I think they'll respond to you, Colleen. Okay, excellent. So I'm hearing nothing from the Zoom meeting. I'm hearing nothing from inside the building. Sounds like we're good to go. And next will be, let me pass this over to Colleen to take a roll call and other things. So I'm going to sit down and divert it to you, Colleen.
Thank you, Chair. This is Colleen Curtis, and welcome. This is the in-person meeting of the Board of Interpreters for the Deaf, Blind, and Hard of Hearing in Flint, Michigan, that is also being live streamed and recorded. Thank you to the board members and the members of the public who are in attendance today, and to those joining us by Zoom. Before we get started, a few items I would like to go over. The agenda and Zoom information are posted on the Michigan Qualified Interpreter website. After the meeting, the approved minutes will also be posted on the website. The in-person board meeting and live stream are being provided with ASL and captioning. People with disabilities requiring additional accommodations to participate in the meeting can email laura-bchs-qualified-interpreter@michigan.gov. For the public comment part of the meeting, the in-person audience will give comments first and then those on Zoom. We are using the Zoom webinar platform, and your video and audio are currently shut off. When it is time, participants on the Zoom who wish to comment should type comments in the chat feature. If you wish to be on camera, click the icon at the bottom of the screen to raise your hand, and then we will recognize you and ask you to turn your video and audio on. Additionally, board members and department staff are not permitted to respond to public comments. Public comments, if you can, limit those to around 3 minutes. Thank you again for joining today. I will now turn it over to Department Staff Member Heather Keel to call the meeting to order.
This is Heather Keel. Good morning, everyone. I will first go ahead with roll call and then read the communication policy. Mitch Halali.
Present.
April Davidson.
Present.
Sarah Houston.
Present.
Miriam Andrade Cuevas is not present. Rowan O'Doherty is not present. Miles Hudkins.
Present.
Okay, with that, we do have a quorum today. And I will go ahead and read the communication policy. The following communication policy is proposed for Board of Interpreters for the deaf, blind, and hard of hearing, and visitors to facilitate successful discussion and debate during meeting proceedings. It is intended that by following this policy, communication will be achieved for everyone present and will improve the effectiveness of the meeting. Board members should wait to be recognized by the chairperson to speak. The chairperson will recognize the speaker by name and allow for adequate discussion of all issues brought before the board. At any time during the meeting, If any board member or public attendee needs adjustment and communication facilitation, they should get the attention of the chair by raising their hand. All voice votes will be taken by raising of the hand. Avoid sidebar conversations. No comments from the public will be entertained during board discussion and should be held for the public comment section of the agenda. Board members are not permitted to respond to public comment, and public comments should be limited to 3 minutes. Okay, next on the agenda, we do have approval of the agenda. Do you want me to turn that over to you, Diana?
Mm-hmm. Yes, that's fine.
Okay.
Does
Do we-
anyone have any addendums, or Sarah saying, I want to move to approve the agenda as stated. This is Mitch, I second that. So we've got a second. This is Diana, okay. So now we need to have a vote. Alrighty, looks like we have everyone voted.
This is Heather Keel. With there being no objections, the motion passes.
So no objections, okay. Let's move on. All right, so I want to take a look at this. Let me see here. What's next is the subcommittee. Do we have, oh, hold on one moment. We're on number 4 here, the approval minutes from the October 8th, 2025 meeting. Are we going to do that now? We're going to do that for the October 8th meeting. Okay, so do I have a motion to approve the minutes, or do I need make some edits here? I move. This is Mitch. I second that. This is Sarah. Any discussion? No discussion. Okay, so I guess we're closing the vote here. So we've approved it. The minutes pass without any edits. Okay, we're starting out pretty good. Let's keep moving. All right, so let's move on. I don't want to jinx it, but now we're going to talk about old business. To talk about MOUs, the 2013 MOU with the interpreter training programs. Who was it that was going to speak on that today? This is Miles speaking. That would be James. This is Diana speaking. Oh, well, James Scheck is resigned from the board, and they has taken over another position under Lara. That means that this topic is, oh, hold on one moment. This is Miles. I just want to make one, oh, this is Diana. Okay, so I'm going to come to Miles. Miles, you have something to say? I know that there was a discussion about the MOU from 2013. So we want the board to help review that MOU agreement to see if we can update some of that agreement. I know the old MOU attachment is attached here, and James did have more information regarding to this as to how the community wants to see this being updated. However, this old MOU needs to be reviewed and updated. This is Mitch speaking. From my recollection, I agree with you, Miles. However, the MOU is going to become moot. So if we were to renew that, The goals is that the issues with the MOU students, that whether they can go to an internship or not, will be transferred under the rules. This is Miles. Okay, perfect. Okay, so more or less we are going to say this is applicable, and we're going to sign the old MOU. We're going to table that. And these, okay, are we done there?
Okay, now on to new business, the subcommittee with the Michigan Needs Assessment report. Miles, that's yours? So Miles, you have the floor.
Do you want me to stand, or would you prefer I go up to the podium?
Which would you prefer best?
I don't mind either way. I'm fine with staying right here. Do you want me to stand? All right, so we've established a subcommittee. April, Mitch, and myself, we created a committee, and we have met frequently and had some discussions on recommendations that come from the report. So we have a few recommendations based upon that report and some of the issues that have come to light in that report. First recommendation would be to focus on addressing barriers to access to this profession. Our recommendations are supporting the development of public bachelor programs here in Michigan, preferably using a 2+2 approach, meaning using community colleges and deaf studies programs and interpreting programs across the board, and showing our support for need for training opportunities. Currently, Michigan has no public 4-year interpreting programs. As recently, the Siena Heights closed their program and will no longer be offering a bachelor's anymore. The 2+2 program, that model promotes collaboration instead of taking over the entire programs, the current programs that are currently in place. And this approach will help strengthen our interpreting pipeline to help students become test ready and increase the numbers of certified interpreters. And that's our first recommendation. Our next recommendation is in focusing on improving accountability in healthcare settings. Our recommendation is to help promote the development, dissemination of best practices for interpreter use in the healthcare field. That includes clear guidance on ADA compliance and how the process goes for securing qualified interpreters in that particular profession. And the rationale is that data indicates inconsistent interpreter use and ongoing access issues in the healthcare environments. Education targeted to healthcare systems to help their compliance, to improve compliance, patient outcomes, and overall access for deaf individuals. And that's our second recommendation. Moving on to our third recommendation, focusing on helping strengthen regulatory accountability and oversight. And the recommendation here is exploring the creation of specialized consultant roles that are focused on different professions, such as educational, medical, and legal interpreting. And these consultants can provide specific skills and expertise within those lanes that they are accommodating in, and provide the statewide providing statewide education and guidance and best practices in ADA compliance. And this model supports the standardization, and it supports oversight and working on development across the different fields within the interpreting field. The fourth recommendation was to focus on evaluate and improve the current complaint process. Recommendation being increase accessibility and effectiveness of the complaint process. And how are we going to do that? Is by establishing a deaf ombudsperson, and different roles to support community members and helping them navigate formal complaint processes. And then continuing and strengthening our partnerships with the Michigan Department of Civil Rights to provide education on how the community can file complaints and improve their accessibility, and also track complaint data. And the rationale for this is the current complaint process is quite difficult to navigate, and it's hard for deaf individuals to use that process. So with a deaf ombudsperson, that be deaf-led, and the support would be clearer and provide that education about how to provide those complaints. It would also increase trust and transparency. Also, it will help improve the data tracking, so that way we can see the complaint process. Our fifth recommendation is, it's a two-part here. We have some subcommittee for board considerations that we would like you to think about that would be helpful. First of all, the first subcommittee we are talking about is a database modernization task force that would help our current systems that we have in place, that would help them become more effective. Focus areas would be online payment functionality, CEU documentation and tracking, and improved search features and overall database use. And then the second subcommittee would be two different regional needs, focusing on Northern Michigan and Western Michigan. We would like to see the two subcommittees address the interpreter needs that are happening throughout the state. We know that there's a scarcity in those specific areas. And we want to focus on their specific needs and what their challenges look like specific to their areas, and help them develop strategies as we can recruit interpreters in those areas, and also help them share the best practices for that particular region, those particular regions. Those are our recommendations. If you have any questions, I'm here for them.
Thank you. Any questions from the board? Mrs. Sarah? No questions. Sarah saying, I'm not a question, but I have something to say. Diana's saying, you can be next, or you can go ahead. Mrs. Sarah, I really like your recommendations. Thank you to the three of you for working hard to work this out and work together. I know that you spoke about not having the four-year program as a public university here. And there is an opportunity. I don't know who we should approach, but we've already chatted with a little bit, and I want to throw this out there. There's a new provost of academic affairs at MSU. That woman is from Riverside, California. She also used to work at Western Oregon University. They have a master's program there for sign language interpreters. And she's really pretty open to possibly setting up something there. So I know people, but I don't know anything, so maybe that is a possibility, throwing her name out there. Could talk to her maybe and solve that problem. I think that would be wonderful to bring that back to MSU and, have that in a centralized location, a central place here in the state. So that's just something for you to think on.
Yes, and I think there's multiple opportunities available to us, and I would like to see multiple programs being established, but we have to start somewhere, and there's definitely things that we could definitely work on and perhaps tap into, so maybe we can have a conversation later about this.
This is Diana. I have to stand. I am so sorry. Thank you to the three of you for taking this on. This is very well done, and I'm just this whole time like, yes, yes, yes. So 2 questions for you, Miles. We require a BA at a collegiate level, but what are other alternatives, alternative pathways for those who maybe they're working, and another way somehow that they're able to get the appropriate certification? Have we thought about that?
I think the NIC itself has alternate pathways for their testing. It's not only you're not required to have a bachelor's. There's whether you're a CODA or you've been working, they have specific pathways there, and I think they're focusing on more of training for the skills themselves for the state. For our current number that we're seeing, and the ITP students doesn't have enough training and time. So the bachelor's would provide them a bit of language and then also interpreting and also providing that training. But for other people who already have some training or CODAs or perhaps have experience with the language already, I think the state and the NIC provide alternate pathways for that. Does that answer your question?
Yes, yes, and no. I'd like to see it written down somewhere, the options for the alternative pathways. Oftentimes we don't document that and it doesn't happen, but people don't see that there are other options. I think we should have something written somewhere.
Well, the BEI has
the options
the
for the
B-
alternative pathways. Okay, hold on. Go ahead, April. I was looking that way. And then you go ahead, Sarah. This is April. Really the only test requirement, the only test that requires a bachelor's is the NIC. And like Miles just mentioned, they do have an alternative pathway set up. The BEI requires an associate's, that's it. Should be short for them. But really, the point of the bachelor's program is not, to say, ooh, hey, here you go, and then you get certified, and there's the benefit in and of itself. But it's, the time to practice and learn and immerse yourself in those internships. I think that's the point of it. And, establishing the rules, we can add a description from the NIC directly, take what they have and put it in there and just show that there is the alternative path. But do you think we need a new path? Is that what you're talking about for like the BEI, like to replace the associate's degree, or can you elaborate?
Yes, that's what I was thinking. Okay, so those are my thoughts. Let's move on to Sarah.
Yeah, this is Sarah. I just want to add that I think what April was saying about, what Diana was saying about, I'm sorry, let me stand. I was thinking about what Diana was saying about the BEI for the state of Michigan. We need to have our own alternative pathway. We have a lot of people here, especially in the Black community, that can't afford to go and get an associate's degree, but they have the skills. So we need to figure out a way that we're able to open that door for them. And again, those numbers are very, very small. And it's not going to happen in where Motown lives. So that's, I agree with you. Yes, we absolutely need an alternative pathway, but that was not in the committee report. That would be under the new rules. And this is April. Can I add something? This might answer that Mitch might be able to answer, but the BEI is from Texas. I'm not sure. Can we eliminate that degree requirement, or do we have the authority to do that, or is that a Texas thing?
This is Mitch speaking. Personally, I believe Texas does not require an associate's
Oh,
degree
okay.
at
Just
this
Michigan.
time. I think that's unique to Michigan. And the rationale behind that, the associate's degree was trying to promote English proficiency. And we see that frequently. About half of the people who take the TEP, the test of English proficiency, that's before you're able to even sit for interpreting or anything of that nature. It's just a written test that's an ABCD multiple choice test for those who can take that. In Michigan, they have typically failed that, and we see a high failure rate, so we have to balance the pros and cons. Do we want to provide the test to anyone to take the test and that might pass it, or are we going to set them up for failure? So I think that you're making a good conversation about having those options. I think it's good to have different pathways, but individuals have to also recognize that English is an important piece of the interpreting profession because interpreting is 2 languages.
This is Diana, okay. So I know we could add that to the, I know that's gonna be in the rules, but I'd like to document, put that on the record, that the board will look at different options for an alternative pathway for the state of Michigan. So I guess I'm making the recommendation. I know I'm not allowed, the board can, well, I'm not allowed to make a motion, the board can do it.
So do you want,
I would like to see that we, the board, put down on record that we will look at alternative pathways. But as a chair, I'm not able to make that motion.
so you need a motion? Is that what you're
Correct.
asking?
I can make a motion? Okay.
Okay.
Well, then I move that we document on record that the board will investigate and bring alternative options, alternative pathways for
the
the
BEI,
BEI
right?
here in Michigan. We have no control over the NIC, so we will not focus on that. We will focus on what we can.
I
here in
second
Michigan.
that. This is Sarah.
Okay. Sarah seconds. Any more discussion on that? This is April. I just have a question because it says the board will. Who's going to be doing that? Should we need a subcommittee to research? I'm just wondering what other states, what other states have. They have a BEI. They may not require an associate's in other states. So, it's a small group of people. We could set up something and just check out what other states have and bring it here at the next meeting.
That's fine. My point is that I wanted it to be on the record that the board is going to research options on how we can get that information, however it comes to light. That's fine. So we want to I'll amend that to perhaps creating a subcommittee that could start this work, or has already started this work, and we could move forward with that with you continuing, or would you rather have a new subcommittee? Do we need a new one? So we need to vote on this current motion first before we can move on to the next motion. All right, so Sarah seconded that, and so we put it down on the record that the board will look into different alternative pathways for the BEI, and we all in support. All right, okay. So the motion passed. So we have that documented. Moving on. Who is going to be doing the work? Do we want to make a separate subcommittee, or shall we?
I thought we decided that.
Should the current subcommittee
I
continue
think we
to
should
work?
just keep it, the current one. This is Miles. Yeah, the 3 of us can do it.
This is Sarah. I think it's the same. All right. Does everyone else
Yep.
feel the same
Yep.
way? This is
Yep,
Diana.
Mitch and April, yes,
Okay.
yes.
So the committee, the same subcommittee of this report will continue their work on this, and I thank you all for your service. I appreciate you. And then I have something else here. Regarding improving healthcare accessibility. I think we really need to take a holistic view. Do we have the right to ask staff people to give us more information regarding their issues, their accessibility issues? Personally, I've experienced them, and just as of recently, it wasn't a small hospital, it was a large healthcare system. And I had an issue, an altercation, and then the complaint was not counted because I advocated too well. And so I finally was able to get another interpreter, but so I'm not sure if I want people to be aware of this, because I don't want to kill the process in the same motion. So that's just something to think about. So VRI is a #1 issue within the healthcare settings. Hospitals do use the words, it costs too much. That is a phrase we hear quite often, and that their budget does not allow for an in-person interpreter. And some people are told that these are your only options, and the administrative system will say that they want to avoid all of those potential costs. As a person, I'm very lucky. I'm able to speak English. I'm very fortunate that I had an interpreter for that short time. My daughter was there as well. But what about a deaf person without that type of supports? How could they self-advocate? We need to look into that, because they have no access, especially with VRI. And the hospitals do say, oh, if you don't take VRI, we'll just go home then. And so how can they advocate for themselves? How can they self-advocate if there's no avenues for them to have access to communication? So we need to talk about other choices there, and that's my comments. Okay, Miles?
This is Miles speaking. You make a very good statement, Diana. Is that they're right? I mean, we can ask deaf people to share their experiences, absolutely, if they're willing to, and that would obviously be very helpful for us. But I think, us discussing this specific, when we discuss this specific topic, we need to really envision like the education throughout the whole state in the medical facilities. What that looks like could be, I think there are a variety of options, but I'd really like to see community members, interpreters, deaf interpreters, for them to be able to educate the medical facilities and help them understand why this is important. We do have several hospitals in the state that have staff interpreters. Some have full programs set up, 4 or 5 staff interpreters there, and they could also help educate other hospital systems, and explain why it's important. What are the benefits to the community? I think there's a lot of ways that we're able to approach this problem. It's valuable and important, yes. My parents too as well, they go to an appointment without an interpreter. What are they gonna, hey, I gotta call in, the whole rigmarole of it. So the families, for people going to the doctor's appointments, I understand those struggles.
Thank you for that,
and then
Miles.
Sarah?
I believe, when Heather came, I do believe that we do have a new role that has been previously established, or just been established. That's a new position that James has taken the lead on. So I do think that is going to be crucial in getting momentum and making things happen. So I expect that this part of Lara is doing their due diligence to make sure that we have a person that will be able to educate people within the hospital systems.
Okay, anyone else? Back to me. All right, Diana. Yes, I am really thrilled with that, absolutely. That's exciting. That, open position is great. But, we need it to be teamed with a deaf person.
Absolutely, absolutely.
Our community, it's our people, and sometimes hearing people preach to other hearing people, and it's just like preaching to the choir. So we need a deaf person there to really, make that impact and represent and show the challenges and look at me as a deaf person. So, most of the time they don't understand that interpreter accessibility is not just for the deaf person, it's for everyone there, everyone. And I would really like to see, that Laura group, for us to work together. I'd volunteer to go with someone to do that presentation, But, I mean, with snow all over the state, it's not possible. But I think we should do some, training, have some training throughout the state, because hospitals will listen to people who live in that area. Who's Diana coming over here to talk? She lives in Davison. What are you doing over here in Grand Rapids? So, we have to get someone from that area who would be, maybe even an inpatient there themselves. And I think Laura needs to look at system development, setting up teams, and letting us in the deaf community be a part of this change. We're very thankful for the help that we receive, but we need to be a part of this as well. Yes, Sarah.
Also, I want to say that I think it's crucial that our deaf community is actually going to apply for these positions. I don't know particularly if it's true if any deaf person actually had applied for this position. I do know that Laura is open-minded to hiring deaf individuals. They would actually like to see a deaf person come on board, and believe me, I've had this conversation in depth with them quite frequently. So I'm very aware of that, and I am very supportive of that, and I know that they are also supportive of that. So I would like to ask all of you in the deaf community, those of you who are qualified to do this type of work and feel like you are competent enough to have that experience to be engaged in this work, please, I'm pleading to you to reach out and apply, and I'm willing to do whatever it is, and hopefully it is, to support you in order to coordinate that action, to put that in place and actually make sure that it's a paid position. Let me make sure that we're not taking advantage of deaf people anymore. We're not making them volunteer their time. They deserve to be paid for their time and their expertise. Thank you.
This is Diana. Okay, thank you. Anyone else have any more discussion? This is Diana speaking. So far, we've assigned a committee for individuals to look at alternative pathways. I would like to make a motion that the committee also looks at alternative placements for deaf education. Deaf educators with a counselor or whatever we want to call it, but for our deaf buds person. Do I have a second on that?
This is Mitch speaking. I'm not really, I don't think I'm clear on your motion. Can you clarify that?
Yes. This is Diana speaking. I'm asking for the issue that to make sure that we have a deaf person involved with the presentations.
Are you talking about for healthcare facility educational?
Yes, and healthcare facility education, wherever, but we have a deaf person there, whether it's a staff hired or as a consult role, a contract-based role. That's my motion, my recommendation.
This is Mitch. I understand what your goal is here. However, I think my approach is going to be a little bit different than your motion is currently in front of us. First of all, I want to hear from Laura about exactly what their expectations of this new role will look like and what the roles and responsibilities is the person that they just hired. And secondly, I think that we can have a say and tell them what we really want. We want deaf people to be engaged in this and why deaf people should be engaged within the process. But for us to hold a subcommittee, I'm not really sure that we necessarily need a subcommittee. I think they're going to start their process and see how the ball gets rolling, and then of course we can have that oversight over it. If we don't like the direction they're going, we can guide them back to the proper path. How do you feel about that? That's just my suggestions.
That's a good point. This is Diana. So my perspective, if it's not on record, it's not going to happen. So I just want to put down that it is, we're, in support of a subcommittee.
So this is Miles speaking. So we can add an amendment to our subcommittee report and add in there in the agenda that we would like to see the deaf community engage in this educational procedure.
Thank you, Miles. Yes, I like your comment to amend it, but the word like. that's an option, that seems optional. I want to have a say, you know, should, must, is that words we can use?
Is April required?
I'm learning legal terminology, you know? Might is not, must is appropriate.
I understand that, this is Miles. They're all recommendations at this point. We can't force them to do anything. All we can do is recommend, and having that documented that there should be a deaf involvement within the educational piece of this.
This is Diana, and whatever place we go to educate, it would be all applicable.
Okay.
Yes, Colleen. Yes, I have a motion for the subcommittee. We will approve an amendment to look at emphasizing a deaf consultant must/should be used in the education process that you are recommending. Do we have a second?
I second that.
Okay.
Miles seconds that.
Any more discussion?
This is Mitch, just a point of clarification here. So the motion is to amend the subcommittee?
Yes.
Okay, you did that. I just wanted to clarify to make sure that everyone in the room understood that.
Okay, right. Yeah, you know that we approved that, but yes, okay. Any more discussion? Closed discussion? Okay, all in favor of that amendment?
Aye.
Okay, now we have to revise the original motion to say that we will amend the subcommittee for that, to accept that report, right?
No, we haven't had a motion to accept this report yet.
I thought we did that the first time.
Mm-mm.
Okay, so we had the motion, they met. Okay, I am so sorry. I jump in the gun here, so let's get that out of the way. Okay. That motion has been approved. We will amend for the subcommittee report, for them to report and look at encouraging, making, you know, a must/should have for the deaf consult role in any education process. Okay, thank you all. Any more? Any more? No? Okay. Okay. Yeah.
Thank you. That's all I have to say. This is Miles.
That's it then, right? We have to make a motion to accept this.
This is Colleen speaking. If you want to formally accept the subcommittee report, you could make a motion, but you don't, it's up to you if you want to or not.
So what happens if I don't? And we just, you know, file it away, right? Will it just go in the trash?
This is Colleen speaking.
Excuse
It
me.
will not go in the trash, no.
Excuse me. Excuse me.
I just want to make sure it's
Hold
on the
on.
record. That's what I want.
Let's just go ahead and make a motion to accept this. This is Sarah speaking, with the amendment
Thank
of
you.
having a report, of the report.
And the
this-
second, Miles seconds.
Mitch, I said support. Mitch is support. I gotta
Mitch support?
support. You support? Yes.
Okay,
No.
okay,
Whatever.
okay.
in that.
Your head was telling me something different. Okay.
We don't want to put this in the garbage. This is Miles
Okay.
speaking. So yes, we support this. All
Okay,
right.
it-
So we've got full
Everyone's-
support.
Yep, everyone's in favor. Great. All right, I feel much better. I'm sure everyone, you know, in the deaf community feels better as well, knowing that it's on the record, not, you know, I think the word is bad, not the trash. We want to file it in the never touched and never finished file. Okay, anyways, thank you so much for the committee and your work. And thank you for, your hard work. It is very appreciated, very much so. And thank you for Sarah, for your work with the people of color in our community. It's incredible. I'm very grateful that you've taken that. I've heard a lot of good things about that. And the board is very active, very appreciative to those, the Laura staff committee. They listen, and I'm sure sometimes we get some eye rolls at us, but, you know, they are willing to be open and work with us. So I just wanted to say that, and thank you to the interpreters as well, who are working here today. Okay. If everyone's okay, we're going to take a 5-minute break. We're going to get up, walk around, give our eyes a break. So if anybody want a motion to a break?
5 minutes?
Okay, fine, 10 minutes. We'll do a
5
10-minute
minutes?
break.
Let's be honest here. This is
Okay,
Sarah.
yep, no, let's do a 10-minute break. Sarah, do you make a motion?
April's saying 10
Who's
minutes is going to be
supporting?
10, 15. If you say 5, it'll be 10. If you say 10, it's going to be 15. Come on, you know this.
I need someone to second this. Can we second this?
All
Okay,
right,
April second. Okay. The motion has been made and passed that we will have a 10-minute break, hearing standard time. Okay, let's go.
Okay. So that's 11:45 then.
All right. We will resume our meeting. This is Diana. It is hard for me to stop the conversations. I'm here on time. We want to make sure we're following the time. 10 minutes, 10-minute break. It's on record. Thank you. My board is proud of me. Okay, what's next on the agenda? We are on partner updates. We are going to jump ahead to MDCR, Michigan Department of Civil Rights, DOD, DBHH. You guys are on Zoom? Okay.
They are on Zoom.
We have to wait until later? Oh, I thought they were going to show up here in person. Nope, they are on Zoom. Okay.
Elena, we are promoting you to panelist. You should see a motion come in. And then go over to the speaker column. Is she there? Okay, and then you want to spotlight her. Hang on just a minute, please. Why isn't she showing up? Okay, we're good.
All right, can you see me? All right, it doesn't matter to me. Okay. All right, I guess I'm going to go ahead and get started while Ms. Lowe is going to join the board. I have quite the agenda here to discuss. The Division on Deaf, Deafblind, and Hard of Hearing is expanding our team. Yay! We will be having someone new joining our team, hopefully sooner than later. Oh, I can see myself now. Whoa, okay, what's happening? Okay, I can't see the interpreter now. This is a little confusing here. Okay, so this is fine. I'll just start signing. All right, thank you. Thank you, Martin, for that. Okay, so we're going to be providing a lot of trainings this year for the year of 2026. We're going to be focusing on healthcare and mental health trainings, and we've already provided training of mental health practitioners, and that was very fruitful but challenging and an interesting experience, and our goal is to expand that training for all mental health professionals. Moving on, also we will be doing a legal court training, courts focusing on accessibility, accommodations, ensuring that all of the staff inside the court system are aware and understand the legal obligations that they have and what the cultural competency looks like, and also a code of ethics and understanding on how the judicial system works with deaf individuals, whether it's a defendant or somebody who's on the prosecutor's side. We also want to talk about training in the educational setting and making sure that students understand what their access rights are, and also their advocates that support them as well, as far as parents and guardians. The trend that we're seeing quite often now is the interpreter pipeline. There's been quite a challenge, which the board is quite well aware of. There's a shortage of interpreters in Michigan. There's a lot of interpreters without availability. And so we're trying to be creative as to how we can get a better interpreter pipeline for the state of Michigan. Also, another issue that we've been hearing about that is quite recent is that some hospitals are creating contracts with some sort of paperwork that is forcing a deaf individual, a deaf patient, to sign that they're giving up their rights, that they have to use VRI interpreters instead of in-person interpreters. That's becoming quite a prevalent issue that we're seeing. We're looking more into that and hoping to find more solutions and figuring out exactly what that document looks like and then how it is considered a violation. So I just wanted to keep you all aware of that and abreast of that, and keep your eye out for that document coming out. Another issue that we're seeing quite frequently is with school districts. They are denying accommodation requests for students when parents and students need additional supports and accommodations in the classroom. The district is denying them their rights. That's becoming more prevalent in the districts, that they're not accepting accommodations because they don't understand what their legal obligation is, and they might not be aware of what resources are out there. So we're stepping in and trying to navigate that and figure out what's going on in those type of situations with those school districts. School districts are using different tactics of resistance. They refuse to document the IEPs in order to engage with the parents, and it's becoming a bigger issue. I think of what we've heard so far, it's been over 4 to 5 districts in the state of Michigan that this is happening in, and that they're forcing VRI in the classroom, which is a disappointment. And for Lara, the board, we need Lara to offer trainings on appropriate use of interpreters in a variety of settings, such as medical, legal, and educational environments. We are in desperate need of a representation to come out and provide those trainings within the community. The community is crying out loud for that. We need these trainings desperately. We also need Laura to provide ongoing trainings to interpreters on best practices, the CPC, the Code of Ethics, and harm reduction, and how to navigate that and understand their role better, what the role of an interpreter actually should be and what it looks like, instead of deviating from that. So we need to have trainings for those types of things. Laura needs to come up with trainings for this. I think that's all for me today. I think that's all my report. Kenya, do you have anything that you wanted to add? Director Lowe, did you have anything you wanted to add? Doesn't seem so. Okay, the floor is yours now.
This is Diana speaking. Thank you. Can you see me, Elena? Well, she's not on there. I can't see her, but thank you. Thank you for your report. It's interesting about your comment. We were just talking about that. You are doing the exact same thing that we were talking about. You know, getting a deaf ombudsman person to be involved and have the department a hearing person with a deaf person side by side doing these trainings and educating the systems. Of course, deaf people, they have their barriers, but the problem sometimes is if they're stuck. You know, if they advocate too well, then they can't get services that they need, or they just get rejected. You know, that was my experience. Just went through that myself. And, you know, they didn't want to provide an interpreter after I, you know, had my discussions with them about, you know, getting an interpreter or not. But this is Diana speaking. I'm not saying we can't, or we never thought about doing a joint meeting with DOD, DBHH, and us, but you know, legally we can't. But I'm not sure if we legally can, but I would love for us to work together on this. We're doing the exact same thing. It'd be ridiculous to reinvent the wheel. So just throwing that idea out there. I'm getting looks. And I'm not sure if it's legal, but just an idea. Maybe that's something the department would be interested in. Sarah.
Thank you, Elena, for all of your hard work that you've given to us thus far. We're in agreement that we need trainings. We need interpreters in the community to know what their actual responsibilities and their roles are, which means training and educating them and those students as well, and their rights to know what interpreters should and should not be doing. I will be the first person to volunteer myself to help out with this effort, with those trainings, just so everyone's aware of that. See me. So I support everything that you stated. Thank you.
Okay, this is Diana. Thank you again, Elena, for your report and sharing with Director Lowe about the possibility of a partnership or a meeting together, collaboration together. Legal or not, I'm not sure, to be determined. Sarah.
I think the only hesitancy about that is where the interpreters are going to be.
In the same room.
Yeah, that's, we have a hard time finding interpreters for this meeting, let alone the Division of Deaf, Blind, and Hard of Hearing, which typically uses the interpreters that are actually working right now or part of the board himself. So finding interpreters for a meeting like that, and the scarcity and shortage is real. So not many interpreters want to do this type of assignment. That's just being honest, but that's something I just wanted to make a note of.
Well, if we have the same interpreters here And then you guys don't have to work, right?
You can ask him, I'm just
I'll have
letting you
to think
know.
about it, but just an idea. That was just an idea. Okay.
This is
Miles.
Miles. Miles speaking. Also, I think we could have future discussions about setting up a subcommittee to meet with the subcommittee of their board as well, and or their council, to make sure that we're not reinventing the wheel. I don't think we necessarily have to have a formal public meeting, but it'd be nice to collaborate with their board and have conversations with their subcommittees and be able to get more in depth about what would be best to provide, what type of trainings would be best to provide to the community.
I like that. I like that. This is Diana. Do I have to make a motion? Somebody want to make a motion? This is Mitch speaking. I know Laura, the QI staff, the qualified interpreter staff, they do frequently meet with MDCR. So I know they are in collaborations. They're working together already. I'm not saying we can't have a subcommittee, but do we need to double the work and reinvent the wheel? I don't know.
Also,
This is Diana. Thank you. This is Diana speaking. I was not aware of that. We were not aware of that. So I wanted to make sure that we know what's going on. After actual meetings, having discussions or something. That's something that I would like to see. Just being informed. Yes, Sarah.
hold on one second. Crap. I forgot what I was going to say. Okay, this is what I was going to say. So they do meet with the Division on Deaf, Deafblind, and Hard of Hearing, but I think a lot of times it comes back with questions. But I would think it'd be nice, perhaps at the next session, I would like to go. Take me with you. Take me with you, Heather. Take me with you. I'm looking at you. I see you.
Me too.
Yeah. So perhaps that we can have some input with those conversations as opposed to just receiving the feedback and getting those questions received back.
This is Mitch. I like that.
This is Miles. I agree with that.
This is Diana. Okay, thank you again, Elena, for your comments and all of your hard work. And I'm excited to see what we're able to do, going forward together. All right. Michigan Department of Education. Wait, hold on. Yep. Right there. Come on up. John Kirsch. Everybody see me okay? Are we ready? Thank you, board. Hello, nice to see you all. Hopefully everybody's staying warm. Man, drive safely as well. My name is John Kirsch. I am the Deaf and Hard of Hearing Educator Consult with MDERDHH, the Michigan Department of Education, Resources for Deaf and Hard of Hearing. Previously, our name was LIO, Low Incidence Outreach. The past year, we swapped names. We changed our name. Changing the website, all the rebranding, fun stuff. Long story short. But, I've got quite a list that I want to talk about today. I'll make it as quick as we can. My boss asked me to make sure that I share these things with you, so here we go. First, the interpreter handbook will be available hopefully this spring. The book is for educational interpreters, educating interpreters, guidelines and standards for admin, the educational team. Really everyone in the district, the ISDs, those who use educational interpreters. ASL classes will be offered. We've been offering, they were full for the winter courses. We did an 8-week course, and we'll have an intermediate course this summer. We'll be offering that again in the fall and going forward. We've offered 2 webinars. They were called Deaf and Hard of Hearing Insights. We've talked about a variety of topics, such as data collection for the deaf and hard of hearing students, and quality reporting to make sure that the trainings are effective. We will host this again in March. It'll be called Practical Approach for Writing Effective IEP Goals. This upcoming fall, we'll be offering a admin conference for those who work with not just deaf and hard of hearing individuals, but also blind and low vision students. I forgot to add that at the beginning. We also have a blind low vision division. The consults, they work with our office. They're under LIO, well, they used to be under LIO, but we've broken into 2 separate groups. So blind low vision and RDHH, but we're still under the same office. We do, support and connect with, blind, low vision, deaf blind as well, so we collaborate in that regard. We also have student advisory boards for both the blind, low vision and the resources for deaf and hard of hearing side. We want to get their feedback. We want to know, what the students the student offices are able to offer. 2 upcoming events that we have. One is going to be the art showcase. We have not had this before, so we're doing it in May. It'll be for students who are deaf and hard of hearing, giving them an opportunity to show their artwork. That'll be in Lansing in May. We also have in June, I believe it's in June, we have a deaf and hard of hearing weekend. It's a camp. We've been doing it. We did it last year and 2 years ago as well. It's growing. So we're hoping more and more people can get involved with this. That information, like I just said, plus a few more, it's one of few things that we have going on. rdhh.org, we have a lot of information on that website. There's an events tab you can click, and you can see month by month what events are going to be hosted under RDHH and the blind low vision as well. I also want to include for Lead K, I'm sure we're all familiar with Lead K. There's a parent resource website that has been established in August, on August 31st. So please, if you are unaware of this or haven't seen it, please check it out. We are starting to promote materials relating with Lead K. We have brochures. All of that stuff is in the works. Oops, I'm sorry. Hold on. I'll stop. We're having an accessibility issue. Do you mean to back up a little bit? We'll start with Lead K materials and promotional materials, brochures, buttons, the works. We're making those right now, and those will be distributed soon. But again, please check out the website for the parent resource. Lead K already has 11 assessments prepared, recommendations. We will be adding 7 trainings to this as well. That'll happen February, March, April timeframe. They're in the works, they're in the process, and everything will be announced on the website. That's, any trainings that are offered, specific assessments, all of that is going to be on the Lead K website. Part of Lead K, it is an annual assessment or an annual report, and we are in the process of making that. It's due July 1st. One project that we just, my colleague told me about yesterday, for school personnel and staff for age 5 and below, knowing their ASL competency, we offer to pay them to take the ASLPI. So we're pretty excited about that. Any more information will be found on our website. Yeah, I think that's it for my report. All right. This is Diana. Thank you so much.
Okay, thank you so much for that. That was a lot of information. It was great. And it was great to see that the parents are getting involved and helping out with the students and the assessments. Love to see that parent engagement. That's exciting. I'm just wondering, do we have on our website the interpreter handbook for educational interpreters that will refer them to their website? Is there a connection that's been made? Is that something that we do? Do we link that resource? I do.
This is Colleen speaking. We have a link to MDE, I believe, for the EIPA, but we can look into linking it to that handbook if we're, if we have it.
Can you repeat that? Oh, okay. Okay. Because there at times interpreters and what parents look at within our LARA website, they may not realize that there's other departments that are housed underneath the state of Michigan, that there's programs available. So it makes sense for us to put those resources, putting that link in there so that way they're able to access that, and that could send them over to those links. I think that would be a great way to make connections and collaborate with these other resources that we have available to us. Sarah, did you have something to say?
No, I did not. This is Mitch speaking. I have a question for you about the handbook. This is the first time that I've seen anything like that. I didn't realize we had a handbook that was created. Were you able to tell us a little bit more about that project? This is John speaking. To answer your question, I think it's been about 2-3 years in the works. Stakeholders and educational interpreters and maybe administrative and a few parents. We looked at a variety of topics. We took the information and put it in the handbook and decided to make our own here for the state of Michigan. The terminology, we were very careful with that. The higher ups in my department, in the Department of Education, they don't think it's necessarily a handbook, it's more of a guide, but legality, we have to follow that. So when I look at the handbook, it looks like, the name, it says handbook, but really I call it standards. So does that answer your question? Okay, I can elaborate. For example, expectations or for roles and responsibilities for interpreters in school settings. They have, administration is able to see that and see what interpreters are, what they should be doing, their roles and their responsibilities, their pay, how recommendations. It's all recommendations. We're not telling them to do anything. These are all just recommendations for them. How to have discussions, contracts. We also pulled a lot of information from NADIN, the National Association of Interpreters in Education. They already had that information. They've got it from their website, so we took some of that information from them, and it talks about benefits, also recognizes educational interpreters as related service personnel. They're equitable to audiologists on the same field as that, on the SLP. They're not just an aide, a parapro for the students. I'm sure a lot of people in the community know the frustrations involved with that, so we were hoping to approach those and address that. Does that help?
This is Mitch speaking. That sounds amazing, incredible. That's exciting. So it seems like we have the laws in Michigan here regarding educational interpreters. At least we have, it's a limited scope, of course. It doesn't necessarily define how to work with educational interpreters, but the handbook is more like best practices. Is that what you're trying to say?
Yes, I would say that. You mentioned the law and legality of it. We took a lot of it from the education, the National Association for Educational Interpreters, and we will be amending the rules, linking that to that. Laura already has asked us for our feedback. We provided our feedback. The handbook refers to some of the rules and regulations. So we've been partnering together. Like I said, Michigan, we made our own here, because we want to be on our turf.
This is Mitch speaking again. When do you expect to disseminate this, and how are you planning on disseminating this information?
We are hoping March, and we will share our website. We also you can subscribe to our updates. We'll send emails with updates. Anyone who signs up on that list, they will receive the information and that announcement.
Excellent. This is Sarah. Just to add to Mitch's comment, so does that mean the districts, it's their choice to go into the website, or is that just something you're disseminating to all of the districts or that have deaf and hard of hearing children, or is it something that it's up to them to locate themselves?
It will be disseminated through the ISDs. The director of each ISD will have an email from MDE. They'll get that email blast, and hopefully, the chains will fall from there. Great. Wonderful questions. Any more? Yes.
Yes, I have one. So you said that your supervisor, who is your supervisor?
My director, her name is Roxanne Belfier.
Not a name I'm familiar with.
Yeah.
All right, thank you. Does anybody else
Absolutely.
have any questions? And thank you, and look forward to seeing your handbook, okay?
Yes.
Do we have someone from Merid? No. And then Michigan School for the Deaf, excuse me, come on up. I skipped them. Hello, I'm Kara Dreschler. Jessica Contreras sends her apologies that she was unable to be here this afternoon with us. I'm the supervisor of student services at the Michigan School for the Deaf. One of my responsibilities is I work with local school districts. If they want to send a student and place them at MSD, I come out and work with them. We do the paperwork together and the whole procedure, and then transfer the student, and we take over the IEPs annually. That's part of one of my duties that I have at my school. I just want to share some fun news with all of you.
Yes.
We have several events coming up, and we invite you all to come out and engage. The first week of February, there's quite a few events. Thursday, February 5th, will be a basketball. We'll have a fan appreciation evening. It's free admission. At 4 o'clock, we'll have the youth basketball team competition, and that will be at 5, and then at 5 o'clock will be the girls varsity, and then at 6:30 will be the boys varsity. And then Friday, February 6th, we will have the alumni night. So girls will be competing with alumni staff, and the boys will be competing against alumni staff. And that'll be a Friday evening, February 6th. And February 7th, well, hold on, let me go off topic here. We've added some different sports opportunities for our students. Currently this year, what's new? We have wrestling. Well, it's returned. I should say it's returned. I should say that. So last weekend, our team went to Indiana or Illinois. I can't remember where it was. But they made it back to Michigan barely before the Snowgeddon came, and they were able to make it up to their tournament. And then other recent sport that has been added is bowling. Bowling, that's a Saturday, February 7th from 9 to 2. We'll be hosting a tournament at the B Bowling here in the area. And we'll be hosting our students, plus the Illinois Deaf School and Illinois School for the Visually Impaired, and also the Kentucky School for the Blind. That will be the tournament. That will be, again, February 7th, Saturday from 9 to 2. So I hope that all of you can make it out. Thank you.
Okay, this is Diana. Thank you. That's really exciting to see MSD open their doors for our community and in ways that we're able to support. That's thrilling. Thank you very much. I really appreciate that. Bowling, I love that. Wrestling, that's great. 7th, 8th, okay. You are busy that weekend, man. Okay, any comments from the board? No? Okay,
No.
all right.
Oh,
Um,
hold on.
Sarah.
I just want the people on Zoom I just want to ensure that you have clear communication. Somebody had reached out to me saying that they just want to make sure that access is happening. As some of the hearing people are saying that they can't hear what's going on, they don't have audio. Is everyone okay? If I could just get some thumbs up on Zoom to know that we have access. Okay, they're checking, our IT team is checking into that now. I'll wait just a moment while they get this figured out.
Okay, we're good. That's exciting. This is Diana. All right, everything seems to be great. I love that you have access. People are making sure they have access on Zoom. Thank you, Sarah. I'm very happy about that. Okay, let me back up. I would like to ask Laura, when you make a list, could you make an exception or a separate line for Michigan School for the Deaf? Have them on a separate line item. Because I seem to that was it easily oversight on my part, and if they had their own line, that would be a lot easier. Thank you. Do we have a representative from Michigan Deaf Association, MDA? Anyone? Seeing no one. I do know that they are struggling to find officers for their organization. I was just told that March 7th, there will be a meeting for them to elect new officers for MDA. I'm not sure where exactly. You would have to check their website for that information. A representative from FAD, Flint Association for the Deaf. I'm seeing none. Okay. Representative from Flint Deaf Senior Citizens Center. No. Representative from the Detroit Deaf Black Advocacy. Nope. We have another communication access. Oh, Myrid. I already mentioned Myrid. There's no one here for Myrid. Okay, next. They closed our partner update. So the Communication Access Center, you don't have anything, do you? CAC, no updates, nothing to report. Anyone else in the audience? Okay. Now we are open to Michigan Department updates. Come on up.
All right, can everybody hear me okay? All right. Well, first I want to thank the board for the subcommittee report today, and the recommendations to us. And just wanted to mention a couple things regarding the recommendations. So we are working on some of this, addressing barriers to entry into the profession, which was the first recommendation. I just wanted to mention that we're working on BEI prep courses. And then also, we recently attended, Peter Norland did, and Colleen Curtis attended the Michigan Career and Education Conference, which works with schools K through 12 to recruit young individuals into the different career areas. So we gave a presentation on what it's like to be an interpreter, what the requirements are, how we have a shortage, and just to hopefully spark some interest. We will continue to look for those opportunities. We go to job fairs and different things like that, so we'll continue to try and spread that word, but I think that kind of falls somewhat, I know not completely under the recommendations, but I think it falls under some of the, that part of the recommendation. And then also, I think improving accountability in healthcare settings. We've been, I'm glad we're on the same page with that because I agree there needs to be some improvement there. I know you guys mentioned about a new position that we recently hired, which we're very excited about. It's not with the QI program, it's with our state licensing consultative section. So that section oversees areas that are healthcare related, our healthcare systems, nursing homes, hospitals, just a slew of different licensed healthcare providers that we oversee. And so the goal with this position is to hopefully get out to the healthcare providers, work with the deaf community, loop them into, what are the needs. We would like to do an assessment to find out where we need some education, both, and some of it we know, right? We've heard some of the feedback, but this position will be starting in February, and so we're definitely open to any suggestions and hear the emphasis on making sure we're working with the deaf community when we're working with the healthcare providers. Our first focus will likely be on hospitals. Not to say that we won't branch off into other areas, but we hear the most complaints about hospitals, and so that's probably where that team will start to focus on. And I think that kind of goes to 3 as well, is strengthening the regulatory accountability and oversight. Somewhat kind of works with that SLICS team, so or we call them SLICS teams, State Licensing Consultative Section, and they'll hopefully kind of share with the hospitals or with the nursing homes or, hospice or whatever the area is, what is the requirements for each of those areas. And so I think that kind of feeds into number 3 as far as the recommendations. And then evaluating and improving the complaint process. I think we're getting there slowly but surely, and today we have with us Jason Schieneman. Can you wave, Jason? He's the attorney that works with our bureau to help enforce the cases that after it's been investigated. So he's been working through the complaints that are forwarded to him if they meet, if there's a violation that's found by our investigation team. So I think we are starting to strengthen that process a little bit, but always open to additional feedback and comments on it. Let's see. And then number 5, the database modernization task force. We are currently working on that now. I have it in my update, which I can go through in a minute, but just to let you know, we are working on it. One of the focus areas was to improve search features and the overall database ease of use, which early December we did do a minor update to it. It's got a new look, so if you haven't had a chance to visit that, I would check it out. We're hoping it's a little easier. We're hearing it's a little easier, but this is only our first step in updating this. We recently obtained some funding to hopefully get this rolling soon. So we're working on the back end with our department leadership, our finance people, Department of Technology, DTMB. And so hopefully we're going to see that starting to move that as far as the complete rehaul of what we used to call MOIS, Michigan Online Interpreter System. And also online payment functionality and CEU document and tracking. Those are both goals of ours. We've started the online payments that started last year, but those are only for our renewals right now. So we want to expand that once we get the capabilities in the new system. So I just wanted to mention that and just also thank you guys for working so hard to review the NAV report, give us recommendations, and provide feedback so that we can do that. But I think we're kind of on the same page on some of these areas, so that's encouraging. All right, I will jump over to, well, in that, did you guys have any questions before I jump over to the update? Yes, okay.
This is Mitch speaking. Curious about the conference. You know, with the Michigan Technical Career, I've never heard of that. I'm not familiar with that. Can you tell me a little bit more about that? What is there? I mean, I understand you explained a little bit just now, but they're encouraging people to get in that profession. But other follow-ups? What should we be doing? What's next for that kind of work?
So it's called the Michigan Career Education Conference. And if Heather or Peter or Colleen have anything to add to what I'm saying, please feel free to jump in. I believe it's annual. It's an invite only. As I understanding, we were recommended to go to this, and we had applied for it through Lara Leadership. So it's kind of I don't want to say exclusive, but it feels a little exclusive to us that we were able to get included in this conference. Our Lara leadership also attended, so like the department leadership, which is above Larry's roles, they attended to support us. While it's a small group, it's still a step in the direction of talking to like high schools, teachers, educators. I mean, middle school, it's K through 12, but speaking with, I think most of the audience was more towards the like high school age teachers, but getting an interest in that and also looking at what programs do we have to in the high schools to teach, you know, ASL and get the interest there, kind of like our other languages we have, as well as hiring deaf teachers. I know Peter talked a little bit about that. Thank you, Sarah. And also, you know, what the interaction with so the audience, we kind of checked to see, you know, what was their interaction with utilizing interpreters, what were the challenges, what were the barriers, but trying to get the conversation started with the group was what our goal was in this, so that we do make sure our young people who are interested in interpreting have a pathway to get there. Does that answer your question? And Colleen and Peter, anything to add?
I would love to say a little bit about the experience going and presenting. Thank you, Heather, for inviting me to share about that. You might be wondering, who was this for? Who was at the conference? And it was for primarily career technical educators, so mostly high school teachers who are working in areas teaching things like culinary arts or automotive repair, other types of high skill, high demand, high wage jobs. So it was a perfect opportunity to talk to people about this very under-known industry and field. So.
Can you stay up here, Peter? I've got more questions for you.
Sorry, didn't mean to run away.
You're fine, you're fine. Well, it's a natural reaction to me typically, so. This is Mitch speaking. So now you're focusing on CTE. I get that, I got a better understanding of that. But, for example, here at Genesee County, we call GCI, used to be called the Skill Center, people still call it that, but the Skill Center is no longer there, kind of like Pine Knob, but my point is they don't have an interpreter training program. So you show up and you say, you know, interpreting is a great career. Are you trying to convince GCI to add that kind of program, or what's your goal? You know, just awareness? And then second question, do you know of any CTE program that has an ASL interpreter program?
Sure. So the goal was mainly to talk about interpreting as a field and a profession, and the requirements that you need to meet in order to become an interpreter and what you can do when you become one. So to generate interest and awareness, some of the attendees at the conference also may have a role in designing curriculum. I had the opportunity to talk with some of the exhibitors and ask them some of those questions. There was an educator from Central Michigan University, and he told me a little bit about curriculum design. So there is that opportunity, really talking to anybody, is my understanding, who is involved in CTE and potentially generating that interest and encouraging students to go in that direction. And then with the second question, could you remind me of your second question?
Do you know of any current CTE program that has or provides ASL or interpreter training?
No, I'm not aware.
Okay, this is Diana. I'm simmering on this, and I got something here. Okay, that's amazing. What an incredible way to, if we could do that starting in high school, right out the gate, acquisition of language and giving them a little flavor of interpreting. And encouraging that, I love that. Thank you. Please continue to do that. And thank you for your presentation. I want to thank you for that.
This is Sarah. Kind of a, second, this is what they're already saying, but, I'm just thinking, oh my God, yes! Get them in, 11th grade, junior, senior year in high school. Get them where they can acquire language and then send them to college. That's where we're able to get caught up and just remind them, hey, we're here, whatever. I think that would be great. I think that would be amazing.
And thank you. She says it much better than I do, much more eloquently. This is Diana.
This is Mitch again. Yes, I agree with what you're just saying. Absolutely, I want to be in full support, second, third, fourth, fifth this. I'm just curious, what is the BCHQI program, BCHSQI program's goal specifically about this issue? Or what are your next steps? Like, oh, okay, so we went to the conference and that was it? Or are you meeting with specific counties, specific teachers, looking at other states, what they have, their CTE interpreter programs? I mean, what's next? Do we have a plan, or is it just kind of, see what happens?
Well, I'd be happy to give the presentation again at any time, but that might be a great opportunity to turn it back to Heather.
Thanks, Peter. So I love that question. If they made me queen, I feel like we could just really make a lot of movements in this industry.
You and me both.
I have a motion to make that. Let's make you queen.
So, one of the things we have to keep in mind with that is that Laura is over the Qualified Interpreter Program. We want to share the knowledge. We want to encourage this. But we don't necessarily have we can partner with others. We can support others. But as far as like pulling in more programs and pushing for that, yes, we encourage it. We want to share our knowledge. We want to share that there's the statistics that we've got from Innovi, from past reports or surveys that have been done, from statistics that are going on now where we know that there's a shortage of interpreters, that we have this many 700,000 plus, deaf, blind, hard of hearing individuals. So yes, we would love to pull more into the industry, but we also have been told to kind of stay in our lane a little bit. So while we are very supportive and would partner with others to help encourage that, and if you all have ideas on ways we can do that, please share with us, because I do think that's a really important aspect. Yeah, Diana.
This is Diana. Can you ask the board to help in that area? I mean, with volunteers or, something to go help, facilitate what you're doing?
Yes, absolutely. So the event we went to most recently was a little bit of a last-minute event, but Larry did say, hey, if we have enough time, let's invite one of our board members. We had 45 minutes and very limited time. So we're hoping in the future, if we do have events like this, that maybe we can pull in board members, or is that not what you're asking, Diana? I'm sorry.
Yes. that is part of it, but also I know that we need, if we need another place, or, you know, we can go and possibly do the presentations, you know, we would be able to go do that and explain a little bit. You know, I think that could be part of our responsibilities, I know, to grow interpreters. I think it's important that we're able to plant the seeds when we're able to. That was my point, essentially. So I was thinking maybe I could volunteer the board. I'm willing to tell them.
This is Sarah speaking. Hold on, I forget to say that. I'm so sorry. Y'all know who I am. Anyways, I'm probably gonna get a lot of grief right now. I'm gonna get shot. Right now, yes, I said shot. Okay, I think we have a lot of talent or people that are on the board who are already engaged in the educational arena. So I would be willing to told them that we are going to work together on trying to move these initiatives to see what we can do. Because I do know that Laura, as they said, they need to stay in their lane. So we wouldn't be board members, we would be just an interpreter who wants to come out and bother people. So I volunteer myself, and I voluntold Miles over here. And this is Diana, I voluntold myself as well. I'm a deaf community member as well.
Excellent. Well, we really appreciate that support, being voluntold or not. We appreciate it. Other questions about just the response to the subcommittee report? No? All right. Well, we'll jump into our updates, and I apologize. Some of it will be a little bit repeat because the subcommittee report kind of overlapped with some of the items we wanted to update on today, but I'll go through those fast. Next slide. So what have we been doing over the past few months since we saw you all last in October at the board meeting? So on December 8th, as I mentioned, our Michigan Online Interpreter System was updated. We do continue to look for vendors to update that. I have a vendor in mind that I'd really like to redo the whole MOIS, our Michigan Online Interpreter System, specifically in. We don't know if this will happen, but Yale University and Michigan State University have really good programs that they partner with us on other registries and systems. So I'm hoping that we'll maybe be able to secure something with them. Good news is we secured some funding, so that's really encouraging. That was not too long ago that we found out that was secured. So now, as I mentioned earlier, we're just working with our finance team, with our administration. There's contracts, there's, Department of Technology and Management and Budget, which is DTMB. So we are working through those. But know that is coming. It's getting more and more real every day, which is really exciting to me because I've heard lots about this and how much we really need to update the system, and I 100% agree with that. So jumping to town halls and administrative rules, as you all know, we have got draft rules right now. We held 3 town halls. One in Livonia on November 12th, one in Grand Rapids on December 2nd, and then a Lansing Town Hall, one on December 18th. The Lansing one was a hybrid one. The other ones were in person only. We had fairly low attendance, but we did receive quite a few comments. So we had about 130 comments to the draft rules that we've been going through and trying to work into the process. And then when we did the online town hall, there was about 25 people who joined virtually. So we're getting the word out there. And today I plan on going through that town hall presentation, which I promise doesn't take a super long time, but just for those that maybe weren't able to attend one of our town halls, this is another virtual opportunity or in person. So continuing with what's been going on with us with the rules. So as you all know, we have the ASL videos that we have posted on our website. And as of January 13th, about 19,000 views of those videos occurred. So we're really encouraged by that. I know it took some extra time, but I think based on those views, really is encouraging to me that we're getting the word out there about, what changes we're trying to make. Jumping off of the administrative rules topic and into future board meetings in 2026. We are looking for community partnerships for vendors, I'm sorry, not vendors, venues, on where we can hold our next meetings. We do have communication started on that. So we're exploring those locations. We know that we want to move around a little bit as much as we can. So we'll continue to explore that and keep you all updated as we know more. As Peter and I mentioned, he attended with Colleen the Michigan Career Education Conference on January 26th, and we were pretty honored to be invited to that, so that was good. Jumping past that, BEI workshops, because of our abysmal pass rates that we have in Michigan with BEI and TEP, we know there needs to be some prep courses and something to help support our interpreters that are wanting to advance or even just obtain basic level BEI certification. We have had several conversations and we'll continue to have that, so we're hopeful this year we'll be able to start offering those BEI prep courses, or at least getting people to the right area, whoever is offering them. We did ask last year with Texas. I think they had one workshop that was like a week long in person, but we really haven't heard much back from them outside of that. So now we're kind of seeking out those individual instructors and trying to get resources in that area. So more to come on that, but you know, I think we're moving in the right direction on that to support our BEI candidates who are testing. So complaints, it's always a hot topic. We've had 7 since October that have been filed, which you probably all remember that we've had 0 for years and years, and so we really are seeing an uptick in those. Our investigation team has been investigating every single one. It does take about 4 months to investigate those. Because of having to get a hold of all the people that are part of it, right? Just because they call the qualified interpreter doesn't mean they're going to respond right away. So we do give them up to 4 months, and then that's where Jason steps in, who, if we need to forward it to enforcement for enforcement action, he helps us navigate through that, and if there's any hearings that we have to do or compliance conferences, he navigates those for us and helps support us in that way. So 7 just from October till now. All right, so we're, yep.
I mean to interrupt. My question is regarding the complaint specific. You received 7 complaints. You're saying it's a long process of it taking 4 months. I'm assuming that means that those have not been resolved at this point. Any of 7 of those?
Of the 7, just in the last 4, or the 3 or 4 months-ish. I think we're still in the process on most of those. We are getting to the point on a couple of them of recommending whether or not we're doing like a suspension or a revocation. We are taking action on the complaints, I can tell you that. And I don't think we included how many we took action on this time, but we can make sure to do that next time.
Okay,
so,
got it.
For sure. But I know we are talking that there's a couple that we're concerned about, and this is a new process for us, and it never ceases to amaze me when I read through some of these complaints like, oh, this was a creative situation, and how do we handle this, and what is our jurisdiction? Is it our jurisdiction? Is it the AG's office? Is it civil rights? And so that's part of why it takes so long, because we really want to make sure we're getting people to the right area. Even if they submit to us and we say, that's not the right area, we want to make sure we get them to the right area so that there can be some impact. So we have worked with our healthcare teams when needed, civil rights, and then just other areas that may fall in, the purview, and when we're looking at these complaints and how to get them to the correct areas. Does that answer your question? Yeah.
Yes, I'm just interested as far as what actions are going to be taken, if any, whether it's discipline or suspension. I do feel like I have to admit 4 months does feel like an eternity.
Sure. It does.
So I'm just curious as to other fields, whether it's nursing or healthcare, what their complaint process is like. Is there a timeline about 4 months as well?
So I can tell you for our certified nurse aid program, it is 4 months as well, because we are talking to everybody involved, right? And it may not take 4 months. Sometimes it takes a month. It just depends on how complex the complaint is, how quickly we can get it to the right area, any of the nuances that we have to look at. and then getting the team together. You know, right now we're meeting as a team. When we get a complaint in, we're looking at having the QI team involved, our investigation team involved, Jason with enforcement's involved, I'm involved. We all talk about it to say, is this the right area? What can we do about it? What rule violations are there? Is there something in law that was violated? So we're really taking a comprehensive approach to it. And so I'd hate to rush that and then not. So I know it sounds like 4 months is a long time, but it is very similar to what we're doing with our certified nurse aides and our medication aides. And it's because we do have to talk to so many people and they're not all available. Hopefully that makes sense.
This is Mitch speaking. I appreciate your comments, and I want to acknowledge that, yes, we want the process to be fair to every party involved. That is crucial to make sure that we are fair to everyone involved in this, and I know that takes time. Plus, you're also using a lot of different teams to look into this matter, so what you're saying is it's good information for us, because 4 months does feel like an eternity. However, if we compare it to others, if it parallels, then that's what's required for a good, thorough investigation.
And I would be interested to hear, I don't know what it is, but if you guys know what the kind of the similar comparison to like RID, is their time frame?
Oh, yeah, it's forever. I don't know. Anything RID takes forever, an eternity.
I was just curious.
This is Diana. This was great. I'm a very visual person. Is it possible that we could make a chart and maybe put, a timeline? Could be 3 months, could be 4 months. For a deaf person, if they file a complaint and they don't hear anything for a while, it makes them uncertain. So I feel like it would be great if we could have something that says, where you are in the process. Because for me, like I said, I'm a very visual person. I had no idea it was going to take 4 months. I had no idea that, it was a multi-departmental process. So, yeah, if we could have that, that'd be great.
Yeah, that's a great suggestion.
This is April.
Oh.
Okay, so on that topic, because it seems like they'll be solved pretty soon, the complaints should be taken care of. We're at the 4-month mark. But right now, with the database as it is, we have, a license would be revoked, but their name is still there. And the status says active.
Mm-hmm.
So we have to click on it and pull them up and see, their certification was revoked. But, people from the community, they just check the database. They don't always click and expand the view. They see the name, they see active, they think it's good to go. So, they won't know that it's actually revoked. How can we change what the database shows? See the name and see that it says revoked, or name and says inactive, something along that lines, because right now it's kind of deceiving to people who are using the database.
Yeah. No, and we've actually had some good discussion about this internally because of some public comments that have come in regarding the draft rules. Not necessarily directly related to this, but very similarly. And right now, it's kind of like innocent until proven guilty. I know that's a bummer, right? But once there has been action taken and the process is closed out, and they haven't appealed it, and we haven't gone down a hearing road, and if that's the case, they could really drag the process out. But once it is finalized, then those results are, the individual would be revoked, removed from the registry eventually. Go ahead.
This is April, but they're still there. There's some that are very old. One person is still on the database. It's been revoked a long time ago. Their name is still on there, and it still says active. I could email you later if you want.
Yes, please do.
Okay, will do.
Please do, yeah. So I think that's good discussion, and it kind of feeds into some of our complaint feedback that we receive for public comments, so thank you.
Miles.
Okay, thank you.
This is Miles speaking. Can a person still work while they're under investigation? Or at that time, are they unable to work during that period of investigation?
Yes, during the investigation they can work. So until there's a determination of whether or not there was a violation, because some of them there aren't violations that we find. And then, there's very clear violations. So we do give them the opportunity to work during that because they may not actually have violated anything. So it just depends on if they choose to work or not. They are aware that we're investigating them, but whether or not they choose to work is up to them.
Thank you.
Anyone else? This is Diana. Okay, go on, thank you.
All right. Okay.
Hold on, we're switching interpreter. Okay, good.
So renewals, that season is coming up shortly, probably faster than we realized. So we wanted to just go over a couple reminders for those that are on that are QIs that would potentially need to renew. So as I mentioned earlier, we have that $30 fee. If you're renewing timely, you can pay that online. Unfortunately, if you're late or it's an initial, then that would have to be mailed in still. We are working on that. I know that's a pain, but it's one step closer with those renewals. You still have to mail in your application. Yep, and that's what the new system that we're hoping to get working on shortly will address to a certain extent. So I know that's a pain, but just reminding people, if you want to renew online or do an online renewal payment, you can do that. So that's one less step you have to go through. So if you send in a payment, like a check in the mail, it goes to another office outside of our area, and then there's a little bit of delay, which could be a week, it could be 2 weeks, however long, until they get it to us, and then we start our processing. So it kind of prolongs the process. So if you're able to pay online, that's great. If you're not able to, we understand, but just also wanting people to be aware of just there's that little bit of a delay if you are sending in a check versus sending it in online. Let's see. Oh, and then just a quick reminder, because we run into this quite often where somebody says, well, I sent my check in, but we can't find it anywhere, And so we've recommended sending it in via certified mail if possible. That way you have something to track it with. Okay, continuing on with renewal reminders. On the application, if you're renewing an endorsement, please be sure to specify which endorsement you would be renewing. And then those with existing endorsements that you're going to renew, to maintain your endorsement, you have to submit the CEUs in the 4-year cycles. So just a reminder on that, submitting those as well. And then to add an endorsement, just make sure the application is submitted with the fee. So I think that's all on renewals. And then everyone's favorite topic, testing statistics. We're getting there. So just before you look too far into this, we send our tests in batches per Texas's instructions. So we do have some pending results this time, so it's hard for us to really reflect who's passed, who's not. But about 45% of our TEP applicants or candidates have passed the TEP most recently. We've had 11 testers take the BEI 1, BEI 2 we've had 2, and Masters 2, and this is from October 2025 to January 2026, so that first quarter. And just a reminder, we are working on those BEI prep courses, so hopefully we'll see some movement in those. All right. So next slide. This is actually jumping into our draft rules, so I'll go through it fairly quickly because I know this presentation's been given 3 times before this, but I did want to allow, because I know not everybody has been able to go to that. So some of the significant changes with our administrative rules that we've proposed fall under training, our qualifications, VRI, testing, renewals, continuing education, and complaints. Next slide. So learning and training before certification. Our current rules, a student can gain practical interpreting experience while supervised by an interpreter during a college or training program while they're in the program. But they can't get anything really afterwards, after they've graduated, and so when are they using their hands to really get that experience? Our proposed rules say that aspiring interpreters can get practical experience before achieving their certification, and so they just have to be either enrolled in or graduated from a course of interpreting. Must interpret while they're being supervised by another interpreter, which is the same. They have to have consent of the deaf, deafblind, or hard of hearing consumer. And it's limited in duration to 2 years, which we've had some comments on that, so that may change. But for those that are in like a 4-year program, this doesn't really help. For those in a 2-year program, and if they started at the beginning practicing, we got to just fine tune that language. So we'll work on that. And then legal proceedings are excluded at this time. Next slide. All right, so advancing certification, our current rules, certified interpreters who want to advance certification must follow a department-approved mentorship procedure that wasn't described in the rules. Now, a basic interpreter can interpret with an advanced interpreter for training purposes, so if they're trying to advance their interpreting level, they can do that. They just have to have a supervision and must have consent from the deaf, deafblind, hard of hearing interpreter or consumer. Next slide. So in our standard levels now, our current rules say that we have a standard level 1, 2, and 3. But 3 is really just obtaining that legal endorsement. So we've changed that to a basic in our proposed rules and a BEI 1. And then if you add on to the BEI 2, 3, I'm sorry, basic is BEI 1. Let me restate that, that didn't come out clear. Advanced is BEI 2 or 3, RID, NIC, CDI, or DI. And then there's an area that will be specified for endorsements, such as legal, medical, mental health. So in our rules, we have a table that has been created to hopefully lay this out a little bit clearer. I know it's hard sometimes to wrap our brain around these types of changes, but I think once we get the rules out and people start to see how this works, it'll run a lot more smoothly. Next slide. So colleges and universities, and our current rules, our standard level 1 interpreters are qualified to interpret in post-secondary educational settings. In our proposed rules, an interpreter must hold an advanced certification to interpret in a college or university. I will say that we have had a lot of feedback on this. It feels like a tug-of-war game sometimes, so we're trying to figure out, where are we getting the most feedback? Is it just 1 or 2 comments, or is this, 20 to 30 comments, and how can we kind of meet in the middle on this? So this one is something that we've had a lot of feedback on that we're trying to work through right now. Miles.
This is Miles. I have a question about this. So the new rules say they must have an advanced certification to work in a collegiate level, postgraduate classes. But advanced certifications will support level 1 working with a level 2 as long as the deaf person agrees and that level 2 interpreter is accepting having a level 1 or a basic as a team, correct? So they would be supporting the idea of working together with a level 1 interpreter in that
Correct.
vicinity, correct?
Yes, correct.
Okay, great.
Sarah.
So that means that nothing's fixed, right? In fact, nothing to fix there.
Nothing to fix, because they can work with, you're saying because they can work with the BEI
That's good.
one?
Correct.
Right.
Yep, perfect, thank you. Okay, next slide. So deaf interpreters is something that we, in our current rules, they must hold an RID or a BEI to become certified in or qualified in Michigan. In our proposed changes, a deaf interpreter is a newer certification or a new certification, and they may become an interpreter without holding the BEI certification. They just have to satisfy the following items. So they have to have an associate's degree or higher, submit proof of deafness, and have achieved an ASLPI 4 or higher, or the SLPI ASL advanced or higher. A deaf interpreter and a CDI can work in elementary settings without an EIPA. So that's what the proposed changes are. Next slide, please. So consent to VRI, we know this is a hot topic as well. In our current rules, it just says that a deaf person may refuse VRI in good faith based on prior experiences or the individual needs or abilities. Right now, we're not seeing that adhered to as much as we'd like it, especially in certain settings. So we tried to strengthen the rules a bit with our proposed changes. The consent to VRI must be obtained and documented from the deaf hard of hearing person prior to the appointment. And then also consent documentation must be retained by the appointing authority for 2 years. So we know this one, we've had a little bit of feedback on, but really, how are our hospitals going to know about this? How are our healthcare facilities going to know about this? How are others going to know about this? When this comes out, this is one of the things I'd like our state licensing consultative section, where we hired that new position to work on communicating with our hospitals, sending out some maybe public service announcements and some other forms of communication, whether that be setting up webinars to talk about some of the changes that will impact healthcare. So that's the goal or one of the goals for that. Right, next slide, please. So VRI interpreter identification. Before starting a proceeding in our current rules, it says the interpreter must show their Michigan certification and government-issued ID. We know this isn't always happening, or maybe is rarely happening. So our proposed changes we're hoping will help support this a little more. Interpreter certification must still be shown before starting a proceeding, as well as a photo ID if requested. And we clarified to specify the rule applies to VRI interpreters. So specifically in that section of the rules, it clarifies that. Next slide. BEI retesting. So currently our BEI certified interpreters must retest if their certification lapses for 90 days. Proposed changes, BEI certified interpreter must retest if their certification lapses after 1 year. This is similar to what we see in our certified nurse aides and some of our other industries that oversee licensure and certification. So if they're lapsed less than 1 year, they still have an opportunity to complete their CE requirements before reinstating. If they're after 1 year, then they would have to retest again. Next slide. Application expiration. Oh, yep, go ahead.
I apologize, just had a thought. This is Mitch speaking. I attended a town hall at Madonna University. A person there made a comment about, some people, game the system, take advantage of the system. Not our system, but RID specifically. They take the NIC and they pass. They have, good standing for 4 years. And then they never take any CEUs during that time. When their 4-year cycle is up, then they decide to take the test again. They pass the test again, and they start a new cycle, and the cycle itself repeats. So I'm curious, with this, if I have a BEI, it doesn't matter what level, but if I have a BEI and I don't get my CEUs, Michigan will say, you are not qualified, you're not a qualified interpreter until you earn those appropriate CEUs. During that year span, that flex time, and if they take the test, could they take the test again? And then pass, and then they don't have to take any more CEUs?
You mean after the 1 year and then they've lapsed?
During that 1 year time frame.
That's a good question.
Yeah, I've never thought about that before. It just kind of came, some people do that, and every year they get their CEUs, but
yes,
some that don't, they just take the test again instead of taking the time and the money to go and get their CEUs. So just throwing that out there. I've never thought about that before.
Yeah, and that's a good point. It seems like no matter how well we write administrative rules or laws or, anything, there's some loopholes that somebody finds, right? And a lot of times when we find that, we try to have some type of procedure that we place internally. But I also wonder, that's a lot of work to take the BEI, and not to say it's not for the RID, but every 4 years versus the 2 year or 1 year after the 1 year. I feel like that's a lot, and there's a pretty high risk people don't pass. So I think that's a risky thing for them to do. And granted, I'm not an interpreter. I may not know fully the way that there's some loopholes and that maybe it's easier for some than others. I'm not sure. But when I think about the BEI, I think it's a very difficult test to pass. And so, not to mention if they fail it, they have to wait 6 months again. So it really puts their career on hold. I think it's a risky process, but it's something definitely we can take into consideration. Yes, Diana.
Diana, I have a question. It may seem ridiculous, but someone wrote in, and if somebody wrote in and said, for medical reasons, I'm not able to work, cancer or something like that, I can't do what's needed, would you allow, a grace period for that, for medical reasons, or is it kind of, hey, too bad?
There is some language regarding extenuating circumstances in the rules, so military service, leave of absences for some reason, if you're out of the country, there's a list, and I can't remember all of them, but there are some exceptions to that. So, no worries.
Sorry, I did not read that part.
Next slide. No problem. Okay, so application expiration. This is truly partially because we have struggled with, the department has struggled with some applications that just sit out there, and so we don't know how long to hold on to them for. Currently, our application has no expiration date, which means we could have it for years, and then which means it's likely outdated. And so we have taken the stance that we'd like the applications to be submitted no less than annually. So if somebody submits to do the TEP or the BEI, and we've offered them several testing dates, and it just maybe didn't work out, or maybe they weren't ready, we just ask them to resubmit their application. If it's not withdrawn within 90 days of notification from the department that it was incomplete, we'll also ask that they resubmit the application. So a lot of times we'll reach out and say, we're missing these aspects of your application. Can you please submit this? And then we don't hear anything for 3 months. And so, instead of just having all these applications hanging out there pending, we just kind of want to have a process to help us to get through some of these applications. So that's that one. Next slide. Late renewal fee. So the current rules say a fee of $45 is due for late renewal. Because we're not really supposed to have too many fees in the law or in the rules, they're supposed to be defined in law. We have removed all rules that mention fees in the rule set that should be defined in law. And so we'll work at right-sizing that in the law, but that's not something that's happening right away, right now, but we are working slowly at that. All right, dates of expiration. In our current rules, an interpreter's Michigan certification may have 2 expiration dates. So if they're holding a BEI with an RID or an EIPA, they might have a couple different expiration dates. What we would like to do is move to a single expiration date, for that way it's all done one time and you don't have to remember to come back on multiple occasions. So that was with the hopes of decreasing some of the barriers to renewals. Next, continuing education. So that's been a hot topic, deaf-blind interpreting. In our current rules, an interpreter may choose whether or not they want to obtain deaf-blind endorsement and complete 0.8 CEUs for deaf-blind interpreting every 4-year cycle. Proposed changes, all interpreters must take at least 1 CEU related to deafblind interpreting over a 4-year cycle. We have had some pushback on this and some feedback and some concerns due to lack of CEUs that may be available currently. So we've heard that the CEUs where they most commonly get their deafblind ones from have lost some funding. So we're taking into consideration how that will impact, and is anyone else picking up that responsibility so that people can get that requirement. Next slide. CEU submission. Our current rules say that the interpreter must submit required CEU documentation when they renew. In our proposed changes, interpreters can submit required CEU documentation when requested under an audit process. We're not requiring this to be submitted during each renewal period. This would be an audit process, which mirrors our other agencies that we work with. So like Bureau of Professional Licensing, they audit. Certified nurse aides within our area audits, medication aides audit. So this would be a auditing process. I will say it's a pretty high level of compliance in the audits. It's not often that we see people not doing it. We have heard some concerns about that, but we're trying to think of some workarounds on this one. I also know that for nursing and for medical professions, they have an application that people can get, and so we're thinking about maybe working with what like BPL does, Bureau of Professional Licensing, and partnering with that application. Super easy system to use. You can put in as you do your CEU, you can get your completion certificate, you can go to the website, quick upload it, and then let's say I get audited as a nurse and I've put all my CEUs in. I don't even know I've been audited because I've just done everything. I just put it all in there. And so that's what Bureau of Professional Licensing uses. It is requiring probably a contract with the company. This is my big dream of like getting this up online with both our CNAs and our QIs. Whether or not that happens, I'm not sure, but that is something that we are considering, and while we're reviewing all of the feedback that we received about this, because there is some concern from interpreters and the deaf community about, well, will interpreters just risk it? And, you know, I kind of sometimes think the same thing about our other industries. And from what I've heard from BPL and the audits that I conduct in our certified nurse aide program, they're pretty compliant with it. So, next slide. Discretion to waive CEU requirements. So current rules, no provision to waive CEU requirements in extenuating circumstances. This kind of goes to what Diana, you were mentioning, that what happens if somebody has military service or has a disability or a medical circumstance or absence from the U.S. This will allow the department to have discretion to waive the CEU requirements if needed. Next slide. Deaf-blind, hard of hearing person rights, specifically related to complaints. So we did, in our current rules, we had situations requiring consent are distributed throughout the rule set. We actually moved that to one area and our proposed changes, and so that the consent are collected in one section so that they know what they need to consent to, when they need to consent, when they have the right to consent or refuse consent. So we tried to move it all to one area, the rule set. Next slide, please. Complete limitations in our current rules. A person must have firsthand knowledge of an alleged violation and must file the complaint within 90 calendar days of the alleged violation. We changed this to the complaint must be filed within 12 months after the alleged violation, just to give people a little more time. This also aligns with our health facility rules, our certified nurse aides, medication aides. So this is aligning with the other division and bureau practices as well.
This is Mitch speaking. I'm happy you let us know that the 12-month is, normal for other professions and their processes. I am curious about MDCR and their complaint and filing process timing, their time frame with the filing a complaint.
Yeah, just making a note.
Yeah, no, you're fine. Frequently we see people don't know, hey, I'm supposed to file a complaint. Where am I supposed to file a complaint? So people think, okay, I have 12 months, I can file a complaint about interpreters. Maybe they can't file a complaint about not providing interpreters because that's MDCR's wheelhouse and their timeline may be different.
Mm-hmm.
So I don't know for sure. Honestly, I'm not sure there. It's 120.
120.
120 days.
I thought it was 180.
It might be 180 days. Okay.
So to clarify, are you concerned that it's too long of a time frame, or it'll just be confusing?
Yes, confusing.
Okay, because they're not aligned.
Because they're not aligned, correct.
Yeah.
Yeah, I think I have, plenty of time. I can file, but to Laura, I can file, but then I might realize I should have really filed with MDCR, but at that point, my time is up.
So I would argue that so sometimes we argue that when it's filed is when that time clock, if there's an extenuating circumstance, we get a little bit tricky with the wording, and I think MDCR would work with us if we were to say they filed timely with us. We just didn't realize it was supposed to go to you guys. We investigated, found out during the investigation, and so
Okay, that's good. That's fine.
what my
Yep.
hopes
I
would
like
be,
that.
and now probably Jason and Colleen are cringing at me right now, but we would work with them in those circumstances where it got routed to the wrong place. It was genuinely trying to go in the right direction, and what Laura does a lot of times is it will say we're using department discretion for some of these things. Some of that we can't use department discretion on, so I can't speak fully for MDCR, but I would hope like if we thought it was our area and then we did the investigation and found out it was definitely not ours and it was outside of their time frame, that we could possibly work with them to do something to try and help. Yeah, Diana.
Okay, this is Diana speaking. So I was thinking perhaps we could put an asterisk of some sort in there that says, please also check into MDCR's timeline, timeframes. It might be easier for them to know in advance that MDCR is a separate thing, whether it's 180 days, so that we could refer them to some place where they can get that information.
This is Mitch speaking. I think, again, we have a lot of education, and we need to make sure that people are aware and know the timelines and what the role is for MDCR, what the role is for Laura, BCHS. So, yeah, I think it's all, like, people here in Michigan need to know their rights.
Yeah, and with when we're writing rules and figuring out what can we put in the rules, what can we not put in the rules, who can we reference, who can we not. Like I said, if I were queen, I'd love to be inclusive of everything, but there are some things that the powers that be would tell us, you can't do that here, but you can put it on your website, you can put it out in educational materials, you can do it. I think it's a great idea, Diana. I'm not sure if they'll let us, but we can look into doing something like that if they allow us to. I haven't seen it in other rule sets, not to say that it's not out there, but definitely it is a point that we can take into consideration, because you're right, this could be a bit confusing on that. So go ahead, Diane, or Sarah. Yeah.
Go ahead and wrap up. I'll ask you. I've got a few questions for you.
Okay. This time we wanted to put a couple, so we hear a lot of feedback from everyone about, did you put it on Facebook? Did you put it on social media? Did you how are you communicating this information? So we wanted to put on one of the slides to how you can stay updated. Our Gov delivery, you can sign up for that so you get every announcement that comes out with us. Laura Facebook, we also have been trying to be better about posting on. Laura Communications has been pretty supportive of getting our messages out there for us, and so we're working towards it, so I wanted to make sure the slide was in there in case you guys had any questions about how to get our information that we're pushing out in our listservs and our Gov deliveries, our communications out to the public. So we're getting there. But yes, and I just want to say, always appreciate when you all have connections on different social medias that you share with those, so we appreciate that. Questions? I think that's all I have, because the last slide I think is just our contact information.
This is Diana. Thank you so much for your in-depth report. Sarah?
This is Sarah speaking. Heather, I always want to thank you. We're so grateful for you. You are always incredible and open to try to do what we ask of you. So I want to take a moment to acknowledge that, and thank you for forwarding things to other departments, especially if they're not necessarily related with you. I know people have reached out to me about some things, and I've reached out to you, and I said, "Oh, send it to me. I'll send it over to here," and then you help take care of that, and that's been quite impressive that you've taken the onus of doing that. So I want to congratulate you on that. And I also want to talk about Elena Lale was talking about trainings that we provide to our interpreters, and I'm just curious if we can mandate particular trainings that have to do with what interpreters should and should not be doing when it comes related to PPO or power over privilege and oppression, and the ethical piece. So those types of trainings, interpreters be mandated to take that, not just once, but perhaps having them taking it annually or perhaps once a cycle, something of that nature, but keeping up with those types of trainings.
Are you talking CE type of things, mandates?
Yeah, like Elena Lale was talking about trainings provided to interpreters about what it is that is expected from them, from interpreters, and what they do, and making sure that that type of training is mandated. And also, I haven't seen anything related to agencies yet. I have yet to see any language related to that. Agencies are doing things that they are very aware of that they're not supposed to be doing, but there's no ramifications and they don't care, quite frankly. So we're not holding them accountable. It's really a loss to all of us who are working in this profession. We have some good agencies who are doing what they're supposed to be doing, and sometimes it seems like they're not getting as much from the interpreters as other agencies who aren't necessarily doing what they're supposed to be doing, and that. So I really want to see some accountability for agencies who take advantage and make a lot of money from our communities, but they aren't actually subject to the rules.
Mm-hmm. Yeah.
That doesn't
I can
feel
tell
right to
you
me.
they've started to reach out to us on some questions. I've personally answered some questions on them. Whether or not that's all of them, I don't know. Colleen, do you remember if we have any jurisdiction over agencies? I was trying to remember what our list was from the AG's office.
Yeah, this is Colleen speaking. So we did ask the AG the question about our statutory authority, who we can regulate, and agencies, it's tough because the statute needs to give us authority over agencies. So we asked the AG to look into that. Yeah.
That's a step in the right direction. That's never been taken before, so I'll give you that. That's a good thing.
Just to piggyback on that, while we're looking at the statute, while we're looking at, for that, we're also looking at potential changes to the fees. And so if there's something obvious that we need to look at for our next steps after we get these rules done, then those are our next steps that we can start to look at. And how do we impact the law now or in the statute to try to address some of these other things?
I completely agree with that, because we definitely need to make more money. It's nice that our fees are low. It's nice and convenient, but comparative to what you are spending in hosting these meetings just hosting these meetings does not compare. So we really do need to bring in more of an income, and I hope that can get moving. I also wanted to make a comment related to the interpreting community who are complaining about getting the deafblind endorsement. You all have a choice to do that work. You still have a choice. However, there's nothing wrong with being a well-rounded interpreter. You should be aware of every field in there. Perhaps you aren't planning on becoming a professional in the deafblind, expert in deafblind interpreting. Maybe you are not an expert in that particular field, but that doesn't mean that it will harm you to acquire that acquisition of those skills, because there could be a situation at one point that you might need that. So complaining really about this new requirement, I don't want to hear it. And so we should be doing everything we can in our powers to be the best interpreters for the community that we serve, period. And you don't deserve to be here just because you have a piece of paper. Absolutely not. You have to earn the trust of the community and of the community that you serve, period. And I think that's it for me.
Thank you, Sarah.
This is Diana speaking. Okay. I don't think we have anything to vote on. Okay. April is saying, I have to leave. I'm sorry. This is Diana speaking. Are you done?
Yes, I'm done.
Okay. I'm so sorry. Thank you. This is Mitch. Thank you. April, you are excused.
Colleen, do we have to
And-
end the meeting and then we can hear public comment, but we just can't respond to it because we don't have quorum?
Right, that's exactly what I was going to say.
Can you just?
We can't
nod
vote.
and-
Like, we
You
can't
can't
make any
vote.
motions.
Yes, we can't vote after this. Sorry.
So we can officially close this? No, because we can have, we can't have the meeting? You can't even end the meeting because I'm leaving the meeting? We can close the meeting, but then have public comment. This is
Yes.
Diana speaking. Okay. So can we make a motion to adjourn the meeting? Is that right?
Yes.
What does that mean? Adjourn the meeting? What do we?
So if there's a motion, then you would honor that motion, but you could continue and take public comment. But since you've lost a quorum, there's no more voting or anything
Yeah,
like
we just
that.
wouldn't vote today. We're good with voting, right? Okay.
Okay, but for the public comment, we can still have those on record, correct?
Yes, but if someone brings it to a question whether or not you have a quorum, then you'd have to entertain that you don't have a quorum and end the meeting.
We can work through that. I think April just needs to
Yes.
Yes. Be here while we adjourning the meeting, right? And then we can work through those things, right, Colleen?
Okay, that's fine. So we don't have to make a motion to adjourn the meeting?
We do.
You just go?
We do. No, we do have to make it, right? Colleen, we have to make a motion to adjourn the meeting?
Since it's been, if there's no motion, you can continue to take public comment. If there is a motion, you do need to entertain it and adjourn the meeting.
That wasn't clear to me. Sorry.
I'm sorry.
Do we need April or not to close the meeting out?
I think at this point, you could adjourn and then just take public comment.
Yes. So, are you making the motion to adjourn?
I make a motion to adjourn the meeting.
I second that. This is April Davidson.
Okay. This is Diana. All in favor? Any
All in
discussion?
favor?
Discussion?
In
No?
favor?
Okay.
I would like some discussion.
Miles? You
No,
want to have a
I'm just
discussion?
kidding.
Okay.
I'm kidding.
Okay.
I'm kidding.
Oh, boy. All right. Okay. So
Meeting
meeting
adjourned.
is formally adjourned, but we will still continue with public comment. Goodbye, April. Drive safe.
Thanks, April. And
Drive
from the
carefully.
department standpoint, I just want to say thank you to our board members because we haven't had it this close before. So this means, we have a really engaged board. So thank you for all your time doing this. And we know people have other commitments. So Colleen, turn it back over to you or is it to Diana?
Sure. Colleen speaking. Chair, what is your preference to move now to public comments or?
Yeah.
Yes? Okay.
Yes. This is Diana speaking. I move to start public comment. Do we have any public comments in the room? Seeing none? No public comment? Okay.
Yeah, there's
And
no
then Zoom.
vote, just, yep, no vote. But there's no more voting, but we can move on to public comments.
But there's no
There is
comment in the room.
Oh,
There's no
okay.
comments in the room. so no
Perfect,
one's-
okay. Next, we have comments that we might have on Zoom.
Yes, that's what I was asking. Do we have any on Zoom?
All right, Remy, I am going to promote you to panelist and allow you to speak.
Can everybody see? No, nope.
One moment, Remy. Okay, go ahead.
Hello. Many of you know who I am. As JJ, I've legally changed my name to Remy. I have a few comments I'd like to make. About 3 weeks ago, I emailed Laura about the BEI. I had a person fraudulently interpret for me. I went on Facebook and asked if they were certified, and they said that they were not certified. And this happened again yesterday. Someone showed up on Facebook. I messaged them, a Grand Rapids information group with different resources and information there. I said, hey, I need someone to. They said they could interpret, and someone in that group said that they would be able to interpret, but they were not certified. So I want to put that on your radar, to develop a plan to address that issue. Let me see my notes. Hold on one second. I'm in the process of establishing an interpreting agency and a cultural competency training. I'm in the process of doing some research, and a problem that I'm identifying and finding is the interpreting rates seem to be a very big disagreement. Here in West Michigan, businesses refuse to pay interpreters a fair rate. Interpreters have to make a living. The businesses don't think interpreters need to. They don't think it's worth it. They don't find it's worth their pay, worth the money. So I would like Laura to strategize with the communication department and send out something about the rules saying, hey, there are rules and regulations about interpreters. They are professionals. It's a challenging job. We get, you get what you paid for. And I'm noticing frequently during government meetings, because of the political comments, especially things with ICE or other data centers, the political climate and municipals and counties are not requiring interpreters for this. But we need to let Laura know about this. The government needs to have interpreters at those sessions as well, those events, those community, at the local level as well. Thank you, Laura. This is Diana speaking. Is that all the public comment?
There are no other comments at this time.
No more, okay. I have to make a motion for this. No, I don't. Okay, so I'm unofficially saying the meeting is done. You are dismissed. Thank you everyone for coming in person. Please drive safely, and we'll see you around. Thank you.